السلام عليكم ورحمة الله وبركاته. عنوان محاضرة اليوم Sterile Product. Sterile products are dosage forms of therapeutic agent that are free of microorganism. So اسمها Sterile Product. Why؟ لأنه subject to sterilization. Subject to sterilization. ومثل ما حكينا الستيريلايزيشن في المحاضرات السابقة هي the process that kill or remove of microorganism. Okay. All pharmaceutical products are sterile? Definitely no. إن منو الsterile products هم parenteral, ophthalmic and irrigation solution. الirrigation solution هي محاليل الغسل لما يكون عندي as a pair, wounds and so on. Of these parenteral products are unique among dosage form of drug because they are injected through the skin or the mucous membrane into internal body compartment. Thus, because they have circumvented the high efficient first of the body defense. That is mean. The parenteral dosage form that is mean given by syringe. معناتها من تنطي خلال السرنجة إنه هي عبرة الديفنس skin layer. لذلك ايش تكون must be sterile. The product developments parenteral preparation may be given by the different routes. البارنترال ايش يشمل عندي الانترافينوس, intraspinal, intramuscular, subcutaneous and intradermal. The nature of the preparation can influence significantly the rapidity of onset of therapeutic effects, form of drug, duration of effects, and the form of absorption pattern achieved. That is mean in nature of the preparation. In other words, إذا كان aqueous solution أكيد الأونسنت أوف أكشن يكون rapid than oil solution. إذا أنا اعطيته ويأثر also على duration. إذا كنت أنا أريد أسوي long acting معناته أستخدم suspension, أستخدم oily solution and so on. Okay. Intravenous and intraspinal preparation rarely are given in the form other than aqueous solution. In other words, إذا كان البارنترال intravenous and intraspinal هو شنو يكون aqueous solution. ليش يكون aqueous solution? Because danger of blockage of the fine capillaries especially in the brain preclude the use of other than solution. In other words, إذا intravenous أقدر أعطي pharmaceutical preparation as a suspension? Definitely no. يسوي لي embolism. In addition to the intraspinal nerve يكون very sensitive. في حين the preparation given intramuscularly, subcutaneously, intradermally can be administered as a solution, as a suspension, as emulsion. Even as a solid pellets may be implanted subcutaneously or intramuscularly. في حين إذا كان الروutes of administration بالنسبة للبارنترال intramuscularly, subcutaneously, intradermally أنا بهالحالة ممكن إيش أعطي البريباريشن ممكن يكون aqueous solution, ممكن يكون oily solution, ممكن يكون suspension, ممكن يكون emulsion. حتى عندنا هذا الامبلانتابل pellets تكون عبارة عن small pellets. هاي شي تكون implantable يا أما subcutaneously أو شي تكون أو intramuscularly. The vehicle can be used range from the water for injection to the glycol to the fixed oil. Although care must be exercised to avoid undue tissue irritation, mild local irritation is permissible at these injection sites. In other words, the fixed oil can be used in intravenous or intraspinal preparation? Definitely no. Since this preparation again intravenous or intraspinal restricted for what? Restricted for aqueous solution. Aqueous solution معناته الوات. Right. The chemical and physical properties of the drug must be determined. Its interaction with any desired excipients must be studied, and the effect of each step of the process on its stability must be studied and understood. طبعا هذا الفيزيكال والكيميكال stability between drug and excipients هذا كل dosage form مطلوب. في كل dosage form مطلوب إنه أني avoid this interaction. Solving system suitable for sterile products are limited to those that produce little or no tissue irritation. Water is the most common. All components must be exponential quality. Right. Vehicle. احنا ايش قلنا؟ قلنا vehicle range from water, glycol to fixed oil. ودائما الفيهيكل اوف تشويس هو من هو؟ الووتر. الفيهيكل اوف تشويس هو الووتر. By far the most frequently employed vehicle of sterile product is water. Since it is vehicle for the natural body fluid compatible. أغلب البادي fluid هو عبارة عن شنو؟ aqueous. One of the most inclusive tests for quality of the water is the total solid content. Gravimetric evaluation of the dissociated and the undissociated organic and inorganic substance present in the water. However, a less time consuming test, the electrolyte measurement of conductivity of the water is the one of the most frequent used. Okay, water for injection normally should not have conductivity of approximately 0.1 part per million sodium chloride. What do you mean by the biology? طبعا الووتر اللي استخدمه في the preparation of parenteral dosage form should be free of pyrogen. Should be what? Should be free of pyrogen. Pyrogen can be defined as products of metabolism of microorganism. So it is a byproduct of microorganism. Most bacteria and many mold and viruses have been reported as producing pyrogen. The gram-negative bacteria produce the most potent pyrogenic substance as endotoxin. Chemically, pyrogen are lipid substance associated with the carrier molecule, which is usually a polysaccharide but may be a peptide. About 1 hour after injection into the man, البيروجين شو يسوي؟ produce marked rise in the body temperature, chills, body aches, continuous vasoconstriction, and the rise in arterial blood pressure. Antibiotic eliminated the fever but not other systemic effects of the pyrogen. Okay, قلنا most popular vehicle for the parenteral preparation هو من هو؟ الووتر. Non-aqueous solvents منو؟ In the formulation of sterile pharmaceutical product, it is some tissue necessary to eliminate the water entirely or in the part from the vehicle primarily because of solubility factor or hydrolytic reaction. في بعض الأحيان يكون عندي الأكتيف ingredients لدرج itself شبيه unstable hydrolyzed in the presence of the water, so the water cannot be used. Or what? Or solubility factor يكون الأكتيف ingredient insoluble. يكون شنو؟ يكون insoluble بالواتر، فأني بهالحالة لازم أضطر شو استخدم non-aqueous solvents. The most frequent used non-aqueous solvents are polyethylene glycol, propylene glycol, and fixed oils مثل ما حكيناها في السلايدات السابقة اللي هم polyethylene glycol, propylene glycol, and fixed oil. Okay. solute هي الفورمولا ايش بيها؟ بيها solute، بيها solvents، وبيها solute، وبيها additive. The physical and the chemical purity of the solute used for sterile preparation must also be exceptional. Why? Because contaminants enter product with the solute have the same effect as if they enter via the vehicle. يعني ممكن الcontamination يجي مثل ما يجي من الفيهيكل يجي ويا من؟ يجي ويا السوليوت. Even small traces of the contaminant may be determination to the product purification of the solid. لذلك ال purification of the solute, purification of the active ingredients used in the parenteral preparation with the high quality. Right. Okay. الفورميليشن ايش قلنا؟ اول شيء بيها السولفنس، وحكينا السولفنس aqueous الووتر، وشروطه لازم شي يكون والنون aqueous. السوليوت قلنا السوليوت هو الاكتيف انجريدينتس ولازم يكون with the high quality، لانه مثل ما تيجي الكونتامينيشن ويا السولفنس تيجي ويا من؟ تيجي ويا السوليوت. الادد سبستانس، هذه الادد سبستانس مو شرط كلها تكون موجوده بالفورمولا، حسب ما احتاجها بالفورميليشن. Substance added to the product to enhance its stability are essential for almost every product. Such substance اللي هي الأدد substance اللي زيد stability هي أو solubility هي solubilizer، احتمال أحتاج solubilizer حتى أزيد solubility of active ingredient in the vehicle. antioxidant إيش وقت أضيفه؟ لما السوليوت يكون susceptible to the oxidation. chelating agents, buffers, tonicity contributors, antibacterial agents, antifungal agents, hydrolysis inhibitor, anti-foaming agents, and numerous other substances for specialized purpose. Okay. container. الكونتينر اللي أخلي بيه الفورميليشن. A glass container traditionally have been used for sterile products, many of which are closed with what? rubber stopper. الفياز اللي موجود بالصيدليات هو عبارة عن شنو؟ عبارة عن glass container والكلوزر مالته شنو؟ عبارة عن rubber stopper. Interest in the plastic containers for the parenteral is increased, and such containers are being used for commercial ophthalmic preparation and intravenous solution. بالنسبة للبلاستيك أكثر شيء يستخدموه بالأوفثالميك ويستخدموه بالانترافينوس solution بالIV fluid. Plastic containers are used mainly because they are light in weight, خفيف بالوزن, are non-breakable غير قابل للكسر, and when low in additive have low toxicity and low reactivity with the product. A glass container is still the preferred material for the container for injectable product. The protection of the light sensitive product for degradation out by the use of amber glass. الجلاس اللي يكون لونه بني غامق، فهذا الشيء يكون يحمي الدراج إذا كان light sensitive، يحمي من الديجريديشن. ربر كلوزر، قلنا الفيالس يجي أزواط، يجي أز أجلاس ويا شنو ويا ربر كلوزر. Rubber closures are used to seal the opening of the cartridge vial and bottles, providing material soft and elastic enough to permit entry and withdrawal of hypodermic needle without loss of integrity of the sealed container. طبعا مثل ما تعرفون انه الربر بسهولة كلش تدخل النيدل، سواء كان مال جهاز الاعطاء او النيدل مال الاسفنجة، ما تسوي بدون اي ديستراكشن، وألسو must be sterile. كل شيء بالsterile product must be sterile. Devices administered set for the large volume parenteral, filter needle, hypodermic syringe, inline filter, plastic irrigation solution bottle, a plastic ophthalmic dropping bottle, transfer needle, and a transfer set. جهاز الإعطاء also must be sterile. The material used for devices are mostly the same as those used for container. All devices component must be visibly clean, but the fluid passed through the device should meet the same rigid standard for the cleanness as the product. Okay. الفورميليشن، نيجي على الفورميليشن. الفورميليشن ايش قلنا؟ الفورميليشن قلنا احنا اللي عندنا solvent solute additives. Solvent solute additives. Okay. The formulation of the parenteral product involve the combination of the one or the more ingredients with the medicinal agents to enhance the convenience, acceptability, or effectiveness of the product. Rarely it is preferred to dispense a drug singly as a sterile dry powder unless the formulation of a stable liquid preparation is not possible. بالعادة الفورميليشن دائما نحضره as a liquid، بس في بعض الأحيان due to the stability reasons فشي يحضرون الباودر ويعطون solvents for reconstituted، مثل الموجود بالصيدليات الأمبيسيلين، الأمبيكلوكس، السيفيتراكزون. هاي كلها تجي الهرمونز تجي أزوات تجي أز باودر، وأكو solvents for reconstitute، وهذه for what? For stability reasons. The solvent system. Parenteral therapeutics agent is given by preference as a solution. In aqueous, the solution is physiologically compatible with the body tissue, and the biological response elicited should be reasonably predicted. The desired solubility can be achieved with the mixed solvents. إذا كان الأكتيف ingredient dissolved in water that is okay. لكن إذا كانت عندي مشكلة بالsolubility فأنا ممكن أستخدم mixed solvents. For example, use of approximately 40% ethanol in water to solubilize the digitals glycosides. Okay. Additive. A variety of ingredients may be added to the formulation to provide the required stability and therapeutic effects. Several classes of the additive have been mentioned: antibacterial agents, antioxidants, buffer, tonicity. Chelating agents may be added to bind in non-ionizable form trace amount of heavy metals which is free with catalyzed degradation change. Chelating agents اللي استخدمه بالبارنترال هو منه commonly used trisodium or calcium disodium salts of ethylene diamine tetraacetic acid in the concentration of about 0.05%. Right. Inert gas. في بعض الأحيان استخدم الانرت جاز. ايش وقت استخدم الانرت جاز؟ حتى يسوي لي displace oxygen from the solution and reduce the possibility of the oxidative change in the formulation. إذا كانت active ingredients أو solute susceptible to the oxidation فمن الحلول اللي أنا استخدمها بالformulation إيش أسوي؟ inert gas replaced oxygen. Inert gas replaced oxygen to prevent oxidative reaction. Inert gases may be used to stabilize solution in other ways. For example, sodium bicarbonate injection decomposes particularly during autoclave to produce sodium carbonate, carbon dioxide, and water. Saturated of the solution with the carbon dioxide inhibits this reaction and stabilized the solution. Okay. الأوفثالميك preparation. الأوفثالميك again احنا قلنا بداية المحاضرة إنه السترايل برودكت هو البارنترال، الأوفثالميك والإريجيشن solution. زين. الأوفثالميك preparation also is sterile product. لكن شنو فرقها عن البارنترال؟ هنا الأوفثالميك not essentially free of the pyrogen. Why? Because pyrogen cannot penetrate ophthalmic tissue. Again, the pyrogen cannot penetrate ophthalmic tissue. So, ophthalmic preparation must not be free of pyrogen. يعني مو شرط تكون free of the pyrogen. ليش؟ لأنه البيروجين ما يقدر يمتص خلال الأوفثالميك تيشو. أوكي. product to be installed into the eye. أي شيء أحطه للآي إيش أسميه ophthalmic preparation. طبعا ليش أقول ophthalmic preparation؟ لأنه عندي الدروب، عندي الكريم، عندي الأوينتمنت، عندي الجل. كلها ophthalmic preparation. أي شيء أحطه للعين أسميه شنو؟ أسميه ophthalmic preparation. While not parenteral by definition have many similar and often identical characteristics. The formulation of a stable therapeutically active ophthalmic preparation requires high purity of ingredient as well as freedom from chemical, physical, particle, and microbial contamination. This preparation usually required buffer to stabilize the pH of the product, additive to render it isotonic or nearly so, and stabilizers such as antioxidants when appropriated for the particular ingredients. Those ophthalmic use in the large quantity such as eye irrigation or in the care of the devices such as the contact lens are usually relatively uncomplicated solutions similar to the large volume parenteral. Okay. One characteristic not as critical for the ophthalmic is freedom from pyrogen. Since pyrogen are not absorbed systemically from the eye, however, in the so far as the pyrogen are inductive of the microbiological clean process, they should not be present. That's okay. freeze dried product. احنا مثل ما نعرف الباودر الدراي باودر use for the parenteral preparation either as ordinary باودر او شي يكون freeze dried باودر اللي يكون solid residue as a cake. يعني شلونه بالصيدليه اغلب الهرمونز اللي هو بيرجونال، الجونال، يعني الهرمونز اغلبها شو تكون لايك فريز درايد برودكت يكون الباودر كله از كيك، كله يكون از مثل القطعه الواحده. اوكي. solution intended to be freeze dried must be aqueous. Again, solution intended to be freeze dried must be aqueous. For the drying process involve removal of the water by sublimation. What do you mean by sublimation process? Sublimation process mean removal of the water from the solid to the vapor state. Since the solution is extended for the only brief period during the process, stability problem related to the aqueous system are practically non-existent. However, the formulation must reflect the characteristic to imparted to be solid residue اللي يكون as a cake، قطعة واحدة مثل الكيكة تشبهها after drying, and those required for solution of reconstituted at the time of use. طبعا يعني مين شرحت لكم الدراينج بالدراينج الماتيريال او الاكتيف انجريدينتس لما تكون هيت سنسيتيف معناتها اني ما اقدر استخدم الحراره حتى اجففها، فايش استخدم الفريز دراينج اللي هو يعتمد على شنو؟ يعتمد على sublimation rather than evaporation. The percentage of the solid in frozen block should be approximately 2 and 25%. لحد هنا نكون خلصنا مواضيع البارتس السترايل برودكت. ان شاء الله البارت الثاني نشرحها على المحاضرة القادمة. أمنياتي لكم بالموفقية والنجاح وحفظكم الله من كل مكروه. السلام عليكم.